We're going to get started with our next panel here. We drew the lucky straw right before lunch, so please stay tuned. So before I introduce my panel, kind of getting a consensus here, I wanted to describe what is an EOC, because we throw the acronym out there a lot, and it might be a question for some of you out there, so see if we can't solve that. An EOC is an Emergency Operations Center. Now, the Riverside County has one, its main office, but each municipality develops one there. Ours here is on the third floor at City Hall. And what does the EOC do? It manages the day-to-day functions of that entity. So for the city, it's going to keep the city functioning. It's not running the emergency, it's giving assistance to that emergency, to give them every tool possible to keep that going and keep continuity of the business. So for Riverside County, keeping that business of the county running with each entity in there. So hopefully that answers the question on what is an EOC, and we keep talking about it. So our panel up here is a range for healthcare and EMD, so we'll introduce them. To my right is Michael Alfred. He is the coordinator for the Naval Hospital, Military Treatment Facility Emergency Manager for the Naval Hospital. New position, correct, Mike?
For me, or?
Well, to this position.
I'm new to the position, but the position at the hospital is not new.
Perfect. Over to my left, towards the end, is Rocky Ketchum. He is the director of the Emergency Operations Center for Temecula Valley Hospital. Thank you, Rocky, for attending this event. Jose, I'm going to kill it. Arbayo is the senior PIO specialist for Riverside County Health Systems on the public health side. And then Carrie Mabey is an information officer for the same entity there. And then kind of a add to this, because we keep talking about emergency operations, but we didn't bring in our experts with this, is Shane Reichart, and he is one of the duty officers for EMD and does a lot of this stuff. So brought him in on this panel to kind of give you an idea, what does EMD do and how does the healthcare system interact with us first responders, and they actually play a very key role in this, and I would think it would be amiss without addressing that issue. So my first question is going to be directed towards Michael. Describes your roles and responsibilities in relationship to EMD for the Naval Hospital.
Well, my roles and responsibilities are all emergency management focused. Primarily as a military treatment facility emergency manager, my EM background and the things that we have to focus on are primarily around healthcare. So I have a responsibility to make sure that our hospital and our staff are trained, ready, and equipped to respond to any kind of a disaster that would affect our hospital. We have a 4-story, 500,000 square foot inpatient facility with that capability. Since it is a Board of Marine Corps installation, our primary services are bones and babies. So we don't do a lot of other inpatient care such as cardiology, internal medicine. Some of that stuff is done more down in the San Diego area, where they have a larger treatment facility that specializes in those kind of things. However, we do provide direct support to the County of San Diego as a participating agency in their Healthcare Disaster Council and Healthcare Disaster Coalition, as well as with Orange County. We are responsible to them for Orange County as a federal coordinating center under the National Disaster Medical System. And I have the fortunate ability to be the FCC coordinator for that, and we have 23 participating hospitals. We have a secondary decontamination capability and a mobile decon team for the hospital as well, so we can treat a myriad of decon-related issues as they pertain to patient care. We work very closely hand in hand with our installation partners and our external partners with that as well, and conduct a lot of training specifically with Oceanside Vista, Carlsbad, the Tri-City Medical Center, Palomar Hospital, and then our installation responders with the fire department and the base provost marshal's office.
Perfect. That's a lot, right? 13 facilities. How
Actually,
does
it's
that help?
21 facilities.
I apologize,
21 facilities, 2 states, and multiple counties.
So how does that affect, being that it's a federal government, that you can help the public in this total system? Do you offer services available to the public, or is it?
If there's an emergency and a disaster has been declared, everybody is going to get help, and the government is going to be the ones that are primarily out there offering some additional services, not only to the 80,000 member population of our installation, because we have a 225 square mile base. So it's the largest installation in Southern California, and it's also the largest training installation water-wise in the world. But to help our community partners, there's a thing called Defense Support of Civil Authorities. And until a disaster is officially declared and the Department of Defense is given an order to move, the commanding officer of the hospital has what's called immediate response authority. So they can have a handshake from the mayor of the city of Temecula saying, hey, we need additional help and we can't do it. We don't have any money to pay you, but we would like some help. He can make that decision under that immediate response authority under 3 conditions. That is to mitigate the immediate loss of life, to prevent human suffering, and to mitigate the loss of property. So if it falls into one of those 3 categories, then he can move forward and assist without Department of Defense approval in the first 72 hours. But I can guarantee you that the commanding officer would be working with the city to make that request, because it would have to go, and you know the long string of people that have to approve it. So it would go from the city to the county, from the county to the state, from the state to the federal government, and then they at the state level talk with a defense coordinating officer, and the DCO will then work with the Department of Defense to get us what they call a mission assignment for us to properly be able to render care. But we can and will do it.
Thank you very much. Rocky, thank you. Thank you for attending. I guess the same question would be, what are the responsibilities and roles in relationships to EMD, emergency response?
Well, first off, I want to thank EMD. Riverside County supports our hospitals very well. We get NEMA funding and supplies and equipment from them on an annual basis. When I look at emergency management for a hospital is we need to be here in case there is a disaster. So the first place to evacuate can't be the hospital. We have to be prepared to live through the hospital and through these. In my past, I was raised and worked in a hospital for 20 years in actual fire country in the woods. So these were an annual thing that we had to shelter in place while the town was on fire and be there for the community that needs us. So the last thing you need us to do is to evacuate. So we need to be prepared to shelter in place and to hold our place through just about any disaster possible in order to be here for the community. So making sure that our building is prepared, that our staff is prepared, and that we have the things in place to shelter in place. Just this last year, Temecula Valley added a 10,000 gallon storage tank for potable water, so that if we lost water, we could survive on our own for at least a week. I have generator power to last for more than 2 weeks without any refueling. I have sewer backup capability for the hospital. So bottom line is we can shelter in place for up to a couple weeks without any problem. But we also have to be there for the community. So to be honest with you, the hardest thing I've had in my 30 years of working in hospitals in this role is making sure that my staff understands our responsibility to the community. When your own house is on fire, it's hard to stay at work and take care of your patients when you know that your family and your house is getting ready to leave. So that's an important role, is to communicate that to my staff and every new staff member I got, the importance of us being here during a disaster. It's not if the disaster is going to happen, it's when. I'm old enough that I've lived through a few of these and I've understood it. And I've spent some of these disaster times driving for hours, picking up nurses and bringing them to work during snowstorms and fires that they said they couldn't get to work. Because as much as I want to help, I can't take care of the patient. So We're dedicated to that and to make sure that we are here to take care of the needs of the community as these disasters hit. I'll tell you, the other thing is, the hardest thing during any disaster I've been through is communication, whether it's on a level within the hospital or whether it's multiple agencies trying to communicate with each other. Up until just recently, I don't think we'd even considered that on a multi-entity level. Just in the last few years, we've been working on radio communications between fire and police and communication between the entities involved. Riverside County has a live process situation where we keep track of all disasters. I can tell what every hospital in Riverside County is doing it in a live situation. We don't have to worry about communicating back and forth to each other. We put all our requests out on one system and can monitor each other's needs and wants from the community for its assistance.
Well, I would like to expand on that, getting people to come back to work as we have a paradigm shift in how people treat work and their personal life. What kind of training do you put your personnel through to kind of get it drilled in their mind that, you know, take care of your house, get it, but then you need to be to work because a lot of people are relying on you?
Well, like I said, during new employee orientation, I hit that very hard, tried to bring it home so that it means something personal to them. I also tried to teach them tricks. The one little simple one that was learned during Katrina was phone calls go dead immediately. If you dial outside of the state or outside of your calling area, they usually go through. So I have an Aunt Mary in Nevada that my family all has programmed into their phones, and they report to her during a disaster. I can call in and check with them. It's those little tricks that you can learn for peace of mind. If you know your family's safe, then you're more willing to stay at work. So I give them websites, I give them areas that they can go out on their own and look. I make suggestions of emergency packs in all their family's vehicles, ways to communicate with your family, and realizing that in one fire up in Northern California, I didn't go home for 2 weeks. I just made one phone call and told my family to get out of town. And it's what we do. I mean, I may not be a nurse, but I'm dedicated to our hospital and making sure it can stay open.
Well, knowing you, Rocky, I appreciate that, and I know that commitment, so it's much appreciated. Michael, with their staff at the Naval Hospital, are they military or are they private? And if so, do you deal with that same issue of getting people to come back during an emergency?
We do. We have the exact same worries as any other hospital would. However, we do have some benefit to that because our staff is a mix of civilians, active duty, and then contractors as well. So whether you wear a uniform or not, you still have the same concerns as everybody else. So as Rocky said, we do teach that during our command indoctrination, where we try and provide them as much information as possible and then give them access to what we have online available through our SharePoint system to have access to all of these different things that we can provide to them. We do, just like anyone else, account for at least a 15 to 20% absenteeism after any major incident. That's primarily going to come from the civilian workforce because we can't exactly force them to come in, but with the active duty workforce, we can tap into them, consider them mission essential, and they have to come to work. There's just no ifs, ands, or buts about it. And then we do just like they do, and we make sure that we stay. We have up to 2 weeks of food, so we can take care of inpatients as well as the staff for at least a minimum of 2 weeks. I've got 180,000 gallon water storage tanks. I have 2 of them, enough generators to probably power a small city. But we're doing pretty good. So, you know.
That's great to hear.
Well, you've got to be, you have, just like Rocky said, you have to be self-sufficient. Because even though there's a disaster that affects the city and affects the hospital, it really doesn't matter because they see hospital and that's where they're going to go for care. So we have to be able, willing, and ready to take care of what the community needs, all while going through our own disaster at the same time.
Thank you, Michael. So we talked about hospitals, but shifting into, you know, the EMS or emergency medical services is a system, and a system doesn't function without some oversight at the county level. So Jose, this one's directed towards you. What is your primary function when it comes to a large-scale emergency like that?
Well, good morning. A lot of it depends on the severity of the incident, but basically it's for ours, public information at the public health level. Our job is to convey health-related information through a variety of sources, press releases and things like that, interviews, but it's even more critical during an emergency when it comes to things like social media and things like doing on-the-spot interviews, videos. We were part of the EOC for the fires at Cranston and Holy. We were there as a support role, and we worked with the incident command, providing health-related messages. And so that's one of our functions, is to make sure that our messaging gets out there. In many cases, the messaging, PIO work, whether it's the hospital or EMS or CAL FIRE, getting information to the public accurately and quickly can actually get involved in saving lives. Something as simple as evacuation orders. Get the wrong evacuation order too late out to the public or too soon can cause a lot of confusion and can cause some real trouble. So our function then as the public information arm of public health is to make sure that we provide the information in a quick way. One of the things that's important too in today's world with social media is we have to be one of the first people to provide information. You can't leave a information void, because once you have that information void, somebody's going to fill it. And usually somebody filling it, it's unofficial, it's rumors, it's misinformation. And so our job is to make sure that we get out there right away and start telling people what's going on. Even if it's a preliminary message, we have to make sure that we're the first ones out there and say to the public, either in a press release or a press conference or in social media, we'll be your official information and come to us for updates. And you'd be surprised how many times in these, when we had the Holy Fire and when we had the Cranston Fire, there were people trying to create rumors or misinformation online, and we responded either through the incident or through the EOC clarifying things. One of the things, too, our responsibility is to keep it simple. During an emergency, whether it's a fire or floods or earthquake, people have a hard time absorbing long, detailed information. Our job is to make sure it's simple, no more than 3 things at a time, 3 messages at a time. And it's vital that we keep it short. Don't speak in jargon. We tend to sometimes speak in jargon, EOC, ICS, all these things that the average person might not understand, and particularly during a crisis. They're worrying about getting evacuated or their house burning down, and you're throwing out all this jargon and you're throwing it as a half a page or a page of a press release. They're not going to be able to get it. So our job, Carrie and I, work to make things simpler in an incident. And then again, we work the system. We make sure that we're involved in the decision-making process, whether it's at the EOC or at the ICS, if we're the lead agency. And then as a public health entity, then we always work with the hospitals, and we work with emergency management department to make sure that the health messaging is part of the overall messaging for the incident.
Thank you, Jose. Now, this could be directed towards Carrie or Jose, but what platforms are you using, and how hard are you finding that you have to limit your message to 200 characters or whatever it is to be able to get the right message out there?
Well, fortunately, we have many community partners. So we might be limited in characters, but we have, of course, the videos that Jose mentioned. We have Facebook Live, and then we have a number of community partners that we can help push out their message by retweeting or reposting and partnering with them to make sure that the message is out, that it's clear, that it's timely, that it's relevant. Jose and I are a department of two. And he's a Chargers fan, and I'm a Steelers fan. But we make it work. We're both AFC fans, so we make it work. But, I was kind of taking notes as many of you were talking about preparation. And I think Jose would back me up on this. We talk every day. Every day. We watch the news, we listen to the news, we are constantly watching press conferences, and of course, in this day and age, there's no shortage of news or press conferences. And we sit and break those down. Might be happening, on the other coast. But we break those down and we think about, now, if this happened here, what would we do? What would we say? What worked for their message, what didn't work, and how would we approach that a little bit differently? So that's one aspect that I thought was interesting. We take part in statewide exercises, of course, but I really think it's the day-to-day conversations that we have, really just kind of evaluating the things that we see in the news that help us to be ready for what we just experienced with the fires. We were also, well, we were not certainly a lead agency in terms of the San Bernardino shooting or terrorist attack. We had messaging to put out for that. And that goes to my next note, is that part of our social media, part of our messaging requires us to strike the right tone. And each event is going to be just a little bit different. And I remember when San Bernardino was happening, and we felt like we needed to say something. And, we couldn't suffer over it for too long because people were in the moment. And so I can't remember word for word, but we put out something that basically said, we're watching, we know this is a horrible day, we just want you to know we're here for you. Different messaging a little bit, different tone for the fires, but always projecting a message of calm, always projecting a message of confidence. Because, as Jose said, we want to be seen as the experts, as a trusted source of news and information, because what we see on social media during these emergencies can be, pretty alarming. And that's actually one of my roles. Actually, on a daily basis, I monitor and see what people are saying on social media. And then I report it up, just so we know what we're dealing with, and what we need to respond to, and what we need to allow people to self-correct. Fortunately, when you see a long stream of comments that are a little outrageous, there's generally someone that's going to come in there with a little bit of sense and copy our press release and say, well, that's not what was happening here. Take a look at this press release they just put out. Or they might reference an article in CDC. So we monitor those things and make sure that nothing's getting out of control. So that's what we do. We do a lot of talking. We do a lot of prep. One of the things that we have on hand in preparation is a website that is prepared, dark. It's not open to anybody at this point, but in the event of maybe an outrageous flu season or something crazy going on that public health would have to respond to, we're ready to go. We will have that site up and running within 10 minutes because it's already written, it's already formatted. All we have to do is plug in the information that we need. So these are the kinds of things we talk about, think about, because we know that in this day and age, presenting information with clarity as a trusted source is really valuable.
Thank you, Carrie. So, Shane, bring in the EMD component, and how do you bridge the gap between first responders and the healthcare system to be able to, get a hold of, get in front of some of these scenarios that come out there, especially in the public health area?
Well, I think to start with is when EMD was created, we were created with the Office of Emergency Services that came out of the fire department. In addition to that, and the lesser known parts, at least from a visibility side, they don't have the trucks and uniforms until more recently. We have the Public Health Emergency Preparedness and Response Branch. They were previously, before that, they were even known as the Bioterrorism Response Branch. So they deal with a lot of different emergency type, bigger public health issues. We also have the Emergency Medical Services Agency, so REMSA, Riverside County's Emergency Medical Services Agency. So our picture is bigger than just dealing with fires and the things that they see our vehicles at. When it comes to public health, examples would be last year during the flu season, we had hospitals with extensive hospital wait times, bed delays, and we get involved from a big picture. It's bigger than just that one hospital being impacted as we look at system-wide, what's going on and how can we improve the capacity for the system. That may be working with some of the programs, so Live Process, ReadyNet, and trying to redirect ambulances and spread that load so it's received in more than just one place. We don't want one hospital being so overwhelmed and having people forget that there's other options. So we work with our partners to make sure that that load is spread. We send with our duty officer program, both with an EMS duty officer and a EMD duty officer, we may send somebody down there to see if there's something that we can do. Maybe there's a lot going on and they may lose visibility of the resources that they've got available to them. So by sending a duty officer out there, we can kind of take a look at the picture, see what they're dealing with, and see if there's anything that we can do. Maybe we can remove some barriers, spread that load, whatever it is, and help lessen the impact on that hospital and spread that out through a system. And that's one of the things that EMD is we're a big picture agency. We try not to get focused on just our department. We assist with every county department. When Carrie's talking about impacts to, say, San Bernardino County for the shooting, we help other counties, but we also look to other counties to assist us if we need that assistance. So I know that like the scenario here talks about a big event where our EMS system is impacted, our hospital system is impacted, as we have the ability as the operational area coordinator to reach out to other counties and see if there's assistance that they may be able to provide to us.
Well, let me get into that scenario, you bring it up. So in this scenario, it's much like we had last year. It's gonna come up, there we go. And we're kind of leading into the flu season. So the question is gonna be to the panel is, it is flu season and many people have already received their flu shots. However, according to numerous reports, there's an alarming number of people over the last 2 days that have inundated the EMS system or the ED departments throughout Riverside County, so including 15 deaths. My question to Rocky is what kind of system in place at your particular hospital would you implement for this kind of scenario where, we're getting inundated with flu calls?
Well, it depends. I mean, as far as the hospital's preparedness goes, it's mandatory that we get our flu shots. We offer the flu shots to every one of our patients and everybody that walks in our door. As far as the preparedness for a surge, it's just like any other surge that we do, no matter what the event is. If the EDs are overwhelmed, then we have surge tents we can put up. We have all kinds of ways to expand our services. The first thing we do is try to eliminate some of the people who may have went home the next day or the day after to get an early release to a different care facility, anything to release some of the beds and the stress on the hospital. We also work with our sister hospitals and the EMD. At a certain point, they take over as far as the distribution of patients, because if I just send, say, my patients to my sister hospitals, that may not be a good thing. It should all be run through the EMD to where they can coordinate who has the open beds where and where they can better utilize their time. So these plans have been drawn up for not just my facility, but as a region in general. So the more we practice these on a regular basis, I mean, just in my facility, We meet for emergency management once a month. We have another acronym for EOC is Environment of Care, which is another one of the committees I chair, but the emergency management rolls off of that as well. Again, communication is key. I think the communication that we have between the Riverside County folks and all the players is great. We also, through FEMA, have introduced a satellite system where I have a reverse 911 for 1,000 employees. They can go out in minutes. So that has helped tremendously getting a response when needed for extra staff and so forth. And the one thing I've always noticed in true disasters, not so much in drills, but in true disasters, is you get more help than you can possibly need at most times. Everybody wants to help when the disaster is. Getting them involved in the training and the preparation so they're better prepared for that.
Thank you, Rocky. Michael, I assume that very similar?
Yes, very similar. We actually faced this issue last year within San Diego County where they had an extensive amount of ED saturation, and we had to all activate our surge capacity plans. But one thing that we do have at the hospital, because of the fact that our population is pretty much self-contained, is we have what's called a flu contingency clinic. So if we break a certain threshold where a certain number of people are coming in per day with specific symptoms, then we can activate our flu contingency clinic, and we use all of our surge capacity stuff, and we set that up outside, and we reroute anybody that comes in with specified flu symptoms, and we keep them out of the hospital so that they're not engaging with the majority of the staff, they're not spreading it around the facility, and they're definitely not giving it to other patients. So we do that. And we are part of the County of San Diego's surge capacity plan, so we can move and regulate patients either from us or to us as the different saturations around the county grow. So we can accept patients on that as well. We work with them on patient movement. Last year, the military, we provided a significant amount of medication support for Tamiflu to the county because they ran out of meds. But in the military, we maintain stockpiles, and we do have some of that stuff available, Tamiflu, ventilators, things like that. And then there's also the strategic national stockpile that can be utilized. And as Rocky said, our own hospital command center is activated during that time. We manage what's going on with the incident, and then if we need to rapidly dispense medications or vaccinations to the base, then we just go through them and activate our point of dispensing plan, and then we start vaccinating our 100,000 person population.
Thank you, Michael. Now, I guess this will be more directed towards the public health side. So how are you going to get out ahead of this, especially with a lot of misinformation in there? I mean, you can read the scenario. It talks about there's some misinformation out there, but what are you doing for messaging to the public and then also on the private side?
Well, and clearly, it's not like an earthquake or a fire where it's an automatic incident, it's a buildup. So one of the things you have to do as a department is we're going to have to acknowledge there's an event going on, there's something going on. And then the health messaging has to be developed. It's twofold. One of those would be continue to do the usual things, because I noticed in the scenario, I think it says that the vaccine is still months away from being developed. What we do probably the first thing in the weeks with messaging is make sure we tell people if you haven't gotten your flu shot yet, get your flu shot now. And then the other one is if you have symptoms or if you're not feeling well, stay home, stay out of school. But I think the other thing that's really important, and I wanted to mention that before, is a call for action. You have to give the public something to do. So in this case, you're telling them, get your flu shot, wash your hands, take proper hygiene care. And then, again, on the flip side, then at this point, Carrie's monitoring social media to see what's coming up in the way of the rumor mill. Are we getting these crazy rumors out there about a vaccine being developed? Because you have to monitor for not only misinformation, but intentional misinformation in that maybe somebody's claiming they have a vaccine for this new strain before it's been developed. We have to respond as an agency to let people know that's not the case. Because if you don't respond and it's now not self-correcting, you'll find out now they're hijacking your messaging. So that's really important. And then you get request assistance if it's necessary from neighboring counties or even the state, and if it comes to that point, to the federal. But the health messaging stays the same, whether it's the simple ones I talked about before. The other most important thing too is and this applies to everybody who has anyone who's going to get in front of a camera. You have to make sure that the person you put in front of the camera is coherent, doesn't look like they're a deer in the headlights, and can relay a message without fumbling, because that's so critical in a high-stress situation where you have parents that are concerned about their kids, and you don't want to put somebody up there who just doesn't know what the heck they're doing. And Carrie mentioned how we monitor other press conferences and things. You'll see those people. And my view is that's the PIO's job, to screen that person. Don't put them in front of the camera. Just sometimes, even administrators, they might be high up in the pecking order, but you have to make a decision as a PIO, I'm not putting you in front of the camera, because you're going to cause more harm than good. And so that's some of the messaging that we have. It's really important to make sure that that comes into play. And also working within the system, working with the, I'm sure at some point you're going to create an ICS. We're going to be the lead agency as the health department. So, it's going to be a long, drawn-out process. So make sure you have the staffing available to work over several days and maybe weeks.
And hopefully we have done our job by messaging positive health messages, informative health messages all year long. We don't wait until we know that flu season is upon us. We've been running health messages for hand washing and that sort of thing, and getting flu shots since end of July, early August. So really we strive to fold all those health messages in every day throughout the year.
Thank you, Carrie, Jose. Shane, you kind of highlighted that this isn't just a regional or county borderlines. It almost turns into epidemic/pandemic, abilities. So, how do you build those bonds with those other departments across county lines to be able to, pick up the phone and communicate and get ahead of these as opposed to being reactive?
I think being involved in some of the exercises that go on, I know Rocky talked about planning for things, but some of the planning is translated in the practicing of these things through exercises. So we participate in a countywide, it's actually statewide medical health exercise, to be able to take our plans and actually implement them and test them and see what works and what doesn't work. And through doing those, we also identify where we may need to reach out to other entities. As that was mentioned down there, is that last year the flu really did, it was statewide, and it was actually nationwide as we were watching the numbers, and it was impacting a lot of different areas. And we had to look at that as if we had something that exceeded our local capacities, our neighbors were being impacted as well, and we may not have them to reach out to. So we're always looking at it from a big picture and trying to figure out, okay, if plan A doesn't work, what is plan B, what is plan C, and how are we going to implement those?
Perfect. Well, I'm going to open it up to the audience to ask our questions of our panel. So do we have any questions or statements? Robert, you got to have something, right?
Does anybody have any questions? Anybody? Okay.
Yeah, their question is lunch.
Oh, their question is lunch. Okay, so we're between you guys and lunch. Okay. No, there's no
So-
questions, Matt.
All right, well, on behalf of the city of Temecula and all our partners to our panel, thank you very much. They'll be available for questions during lunch, because I think sometimes people like one-on-one as opposed to standing up in front of everybody, so appreciate it, and a round of applause for our panel. We got a gift for you, so. And come on up for a picture.